Hi, my name is Gianni. I'm your student physical therapist. I'm going to be working with you today. So what I understand is you sustained a fall putting up some Christmas lights maybe, and we have a little right femur fracture, and then we dislocated our thumb.
Yeah.
Okay, so what I'm going to do today is I'm going to help you out. We're going to get you set up right here, and then I'm just going to transfer you onto the chair here. So what I want you to do is, we don't want any force to be put on this leg, so we don't want any pressure with your toes. Just try to keep it as elevated off the floor as much as possible. Try not to touch it on the ground. And then with your thumb here, what I'm going to do is I'm going to kind of help you with that right side, and I'm going to have you push through your forearm and elbow to push yourself up to transition to sitting this way for me.
Okay.
I also want you, once we do that, I'm going to hold your leg here, and I just want you to let me move it. I just want that leg to be straight the whole time, keeping it nice and straight even when we're sitting up, not bending it at all, okay? Alright, so I'm going to help you lift up here first, so I'm going to go here, and then we're going to push through that elbow there. Good. Okay, and then I'm going to swing leg around here. Good. Awesome, and then I'm just going to put a gate belt around you. So have you lift up your arms real quick for me. Feel okay there?
Yep.
Perfect. Okay, so then from here, what we're going to do, I like how your legs right there. So with that left side, we're going to push through your arm and your foot here. And then what I'm going to do is with the belt, I'm just going to help you get up from here, keeping that leg straight.
Okay.
And then when you're coming up with that left leg, once you get up here, I just want you to have kind of like a slight couple hops here. Get into this position, and then keep that leg straight on the way down. Boom. And then we're going to sit there. Okay? Perfect. Okay. You ready?
Yep.
1, 2, 3, good, and then hop, hop, good. And we're gonna come down into the chair, keeping that leg nice and straight. Perfect, good there. That feel okay?
Yeah, that's good.
Awesome, okay. And then I'm just gonna teach you a little bit of walking. So what I want from you here is, obviously, since we can't hold anything with that right side, I'm gonna have the cane on this side with you. Normally, we wouldn't use a cane, we'd either use an axillary crutch or a forearm crutch, and just making sure that she's not gripping it with the right side, so it'd be on the left side. And if we had to, if it was bothering her that bad with balance, we could go to a walker with a platform attachment on the right hand side. So what I want you to do here is we're just going to push through the cane here,
Okay.
push through your leg here, and then I'm going to be helping you out here, just getting up.
Okay.
Ready? 1, 2, 3, good. And then for practice, what we would do is we go with the crutch, and then with the bad leg, and then coming forward with the good leg. So crutch and bad leg first, and then coming through. Yep, and then one more here. Up. Good. Good there. Perfect. Okay, so now I'm going to show you 3 weeks post-op. Hand feels okay, healed, but we still have some precautions with our right leg. So what we're going to want to do is we're still going to want to keep that leg straight and try to not put any weight on that as possible. So what we're going to do with the cane here is, it would be in reverse. So I understand you have a left-sided handrail at home. So pretending like this is the left-sided and then this is the cane. So what we're going to be doing is you're just going to be holding on, so the cane would be here. But in reverse, it would just be, so you're going up, keeping this leg straight the whole time. Pushing through, good leg, boom, good leg, just keeping that leg nice and straight. Pushing up.
Okay.
And then you pivot, and then on the way down it would just be the opposite. So you would keep this straight and coming down. Here.
Expected leg down first.
Correct.
Okay.
Yep. So we're going to start here. So we're just pushing up through there, and then let me just make sure it's fit for you. Yeah, that looks good there. Okay, perfect. So like I said, it would be the opposite. So we're gonna hang on to the rail here, and what we're gonna do is we're gonna go up with the good leg first, keeping this leg straight the whole time. So cane, and then good leg.
Okay.
And then keeping that leg straight, good. And then same thing, cane, good leg, keeping it nice and straight. We'll go one more. Cane, good leg, keeping that leg nice and straight. And now you're gonna pivot, keeping weight off that.
Yep.
And then we can just
Switch sides.
flip here.
Okay.
And then we're gonna go affected leg first, keeping that leg straight, trying to put as least amount of weight on it as possible. And then coming down here. Good. And then one more.
Yeah, that feels good.
Okay, perfect.